Intraosseous cannulation is a medical technique for gaining rapid vascular access by inserting a specialized needle through the cortical bone into the medullary cavity of a long bone. This allows for the emergency infusion of fluids, medications, blood products, particularly when conventional peripheral intravenous access is delayed or impossible. When carried out by a well-trained and experienced radiology worker, intraosseous infusion is a simple and reliable method of giving fluid and drugs in an emergency. The method is safe if the needle is left in place no longer than 6 to 8 hours. Almost all parenteral fluids and drugs can be given by this route. In an emergency, this might be the first choice if access to a peripheral vein does not appear to be obtained. It takes 1 to 2 minutes to establish intraosseous access. The procedure is painful, but no anesthetics is required as it should only be used in an emergency when a child is in shock. Contraindications to intraosseous cannulation include infection at the intended puncture site, fracture of the bone, which is relative contraindication, not for shock, only for reaeration, and also failed intraosseous needle puncture on the same bone. So, if there is infection at the intended puncture site and failed intraosseous needle on the same bone, that's a contraindication. Fracture of the bone is a relative contraindication. The recommended sites for intraosseous needle insertion are proximal tibia, distal femur, and distal tibia respectively. The first choice for the puncture is the proximal tibia. The site for needle insertion is in anteromedial surface of the tibia, 1 to 2 cm below the tibial tuberosity, or 2 finger breadths in children, or 1 finger breadth in infants. An alternative site for needle insertion is the distal femur, 2 cm above the lateral condyle. First, we should have to prepare the necessary equipment such as bone marrow aspiration or intraosseous needle of different size based on the weight, and antiseptic solutions, sterile gauze to clean the site, a sterile syringe filled with normal saline, a second sterile syringe filled with normal saline, IV infusion equipment, sterile gloves. Then we should have to select the site for cannulation. First, palpate the tibial tuberosity, then locate 1 finger's breadth below and medial to the tibial tuberosity. The bone can be felt under the skin at this site. Wash the hands and put on sterile gloves. Clean the skin over and the surrounding site with an antiseptic solution. Stabilize the proximal tibia with the left hand. This hand is now not sterile. By grasping the thigh and the knee above and lateral to the cannulation site, with fingers and the thumb wrapped around the knee, but not directly behind the insertion site. Then palpate the landmark again with the sterile glove or the right hand. Insert the needle at a 90-degree angle to the bone with the bevel pointing toward the foot. Advance the needle using gentle but firm twisting or drilling motion. Stop advancing the needle when you feel a sudden decrease in resistance. The needle should be fixed in the bone. Then remove the stylet if present. Aspirate 1 ml of bone marrow content, which looks like blood, using the 5 ml syringe to confirm that the needle is in the marrow cavity. Flush the needle with 5 ml of infusion solution. The fluid infusion can be started. Apply dressing and secure the needle in its place. Monitor the infusion by ease with which the fluid flows and by the clinical response to the patient. Check that the cuff does not swell during infusion and the toes remain pink. If the child cries inconsolably, check the toes and the cuff. Stop the intraosseous infusion as soon as venous access is available. In any case, it should not continue for more than 8 hours. Possible complications of intraosseous cannulation include incomplete penetration of the bony cortex, penetration of the posterior bony cortex, which is more common, infection, necrosis and sloughing of the skin at the site of infusion. This occurs especially when drugs such as adrenaline and calcium pass into the tissue. Thank you for watching.